Heather.
Hi, Simon. So first of all, how did you get into mental health research?
Well, I work in NHS mental health services and have done for a long time. I'm an art therapist, so I've worked with people who've got mental health problems. And then I guess I got into thinking about how do we improve what we offer people and show that it kind of works for them as well. So then I started to learn how to do research and develop a bit more of a parallel research career alongside my NHS work.
So what does PPI mean to you?
Public and patient involvement. I think for me, it's sort of a partnership, isn't it? That seems to be the important thing. And it's about all stages of that within research. So, you know, developing research, delivering the research, and disseminating it as well. You know, there's something I like about the saying, nothing about us without us. I don't know if you've come across that.
I have. I know that expression.
Yeah.
Well.
So
Yeah,
I think that's really important. I think that about for myself, you know, in terms of services that I might access or research that I would want to be involved in. And so I think that's really important. You know, if we're going to influence and inform people's lives around particularly treatments or, you know, mental health support or services, then it just seems like it's really essential to have people's partnerships within that work, really.
Yeah, I agree completely. It is a working partnership because you're treating the patient, so it's good to involve them from the very early start of your research. So why do you think it's particularly important to have PPI in your research?
If you're doing research for the benefit of people who've got mental health problems, why wouldn't you involve people with mental health problems in the research? I think so. That's the thing. I guess the other bit of it is that it's massively rewarding and important, and these partnerships that we develop with people during research programs are really, really great. You know, they're really exciting, and you know, brilliant people get involved and great ideas. You know, I think it's the point is that people who've experienced mental health problems or access to services or treatments that we're trying to change or improve or develop, then, you know, actually having input can really change how things happen.
I agree with that, Simon. I think, you know, people who've had mental health conditions have a real insight into research, and they can share their lived experiences. And sometimes they can ask a question that a researcher might not have thought of as important, you know, so we can enrich that research for you too. And you know, when it's mental health patients, it's actually quite a relief to talk to somebody about what they've gone through because they want to change it for the future. Can I ask you, have you faced any specific challenges with PPI, getting them involved?
Yeah, I had a challenge with sort of getting representation from people. So in some areas of public and patient involvement, there are some really well-established groups, you know, and sometimes with physical health conditions, they're very well-established groups. And I wanted to do some work with people with learning disabilities and mental health problems. And in the area I live in, there wasn't really an established group at all who I could go to. So I worked with some colleagues, and we managed to reach out to a group that existed. They weren't actually doing anything about research, but they were just a group of people with learning disabilities that were meeting together. So we approached them and asked them if they'd want to kind of participate and comment on the research. And I got to say, they were a brilliant group, and actually they taught us loads about how to organize meetings, how to present information at meetings. You know, they had cards that they would hold up if people wanted to ask questions. They had this brilliant thing, which was a buzzer so that if you didn't understand something, you could just press it and say that, you know, people needed to say a bit more and explain. It was a bit like a kind of, you know, no jargon buzzer. You know, people would press it and say that, look, we need you to explain that a little bit more. So we learned loads from them, and that was great. And so actually, because of that experience, I then had some conversations with our local NIHR Clinical Research Network, and subsequently been able to support that group to become an established research advisory group for people with learning disabilities. So that was a real challenge. I think what I probably could have done is not, you know, in the face of that challenge, is sort of gone to other groups that were public and patient involvement groups, but they weren't necessarily representative of the people that we were doing research with. So, but I feel like that would have been not quite right. You know, we would have got some feedback, but it wouldn't have been as meaningful as the feedback we actually got. And now some of the people that were in that group are, one was a co-applicant with me on some funding, and others are going to be on the advisory group for our research that we're doing. So it was a positive outcome, but it was quite challenging just to kind of set something up.
Yeah, I know my experience is that sometimes people don't understand what research is and how can PPI, how can they benefit, how can they have a voice. And sometimes you have to go out to different settings that you wouldn't originally think of and encourage them that your voice is important and we're here to listen.
I don't know if this is something you've come across, Heather, but there's kind of a lot of practical stuff, isn't there, around, you know, if we're conducting research and we're asking people to attend meetings or complete questionnaires or consent forms, actually, you know, having people's views on that before we kind of take it further it's really important, isn't it? And it actually helps the success of the research, because, you know, people who have got lived experience, as you say, can comment on it early on.
Yeah, I think that's a good thing that research is that we start to think about, is the planning of the meetings. It's not just the people you're inviting along, it's the settings, it's the atmosphere. Do they feel relaxed enough to talk about sensitive issues? Just simple things like tea and coffee and car parking. And, you know, when people start to talk, if you've only given them an hour to talk, the meeting's normally going to be twice as long as what you intended. So 2 hours, you should always list them, allow for a meeting, then people don't have to worry about the car parking.
That's a really good point. It's really, really important. Is, you know, if we're inviting people who've got lived experience and they're coming to either kind of formal meetings or, you know, discussions, what kind of things do you think make that more accessible and helpful? You know, you've mentioned a few things like creating a kind of a supportive atmosphere, but are there sort of key things that you think, you know, I'd really like to be treated in this way if I'm being invited to do something?
I think one thing that's always beneficial is if you send out the information to people in good time, in advance of the meetings, be ready to answer questions and queries, give your email details and your telephone number, so they can freely ask questions and they can take part or not take part. They can drop out if they want to, because it's quite, some people with mental health, they feel quite pressured that they have to do something and they have trouble saying no. And I think that's really important to say, it's okay if you just want to send an email as a contribution. Are you happy on Teams and Zoom, or would you prefer to meet in person? That you be adaptive to how people with mental health want to talk to you. Sometimes they might just want to do a survey, or they might just want to do a questionnaire, or some people prefer like a one-to-one meeting instead of a bigger or a smaller focus group or a big meeting. Depends what you're talking about, really. But yeah, advanced planning, like the locations of meetings, make the meetings like where they go to, like in their community. You'll get much more response if you put it on their doorstep than having to travel for 6 miles into London. You know, you might not want to do that. Yeah, so what else?
Yeah, that's really, those are all really important, you know, just listening to what people need that is
And
going to be most helpful for them.
listening skills. Everybody thinks they can listen, but listening effectively and having a good the person that does the meeting, that shouldn't just be you, it should be someone else. Have you got any top tips that you'd like to share as a researcher?
I think there's a few that we've covered that are just probably worth repeating. And I think that it's that thing about getting people involved early on seems to be really important, doesn't it? And I've even experienced that when I've talked about a design of a study, how we design research, and then people have said, well, you know, that they thought that they weren't really happy with that, you know, that they, you know, when we do things like randomized control trials and we exclude a certain group, we're comparing groups. Well, I've had feedback that someone said, well, actually, if the treatment's looking like it's working, then you should that group that was you know, they should, if they're waiting, they should be able to access it as well. So we've kind of had to think about how we design stuff so that everybody benefits. I think that's, you know, that's just one example of the design process. But yeah, early on, I think, and yeah, listening to what people need in terms of their access as well. And I guess there's stuff around which I don't know, Heather, if this is a little bit tricky for you as well, but there's been some things around, you know, how do we acknowledge the time that people spend with us, you know, advising on research, and there's sort of advice around kind of, you know, vouchers and honorariums and other rewards, and then other people have said, well, actually that affects some of my benefits, so it's got to be something different. So there are those kind of conversations which are really important to have about, you know, recognizing that people are committing to something, and what's going to be an appropriate sort of reimbursement for that time, I suppose.
I think quite often when you're doing the research, it depends who's funding your research. If there is a budget to pay for people's involvement, PPI, because sometimes there isn't, but there really should be. And also there should be a choice, whether they want to have payment or expenses or vouchers. Some people might think, oh, it might influence on what people say. But I think the most important thing is to give people that choice, and Involve do a big guideline package, which is really useful for researchers to look at it with the guidance and the payment, the time spent on involvement, and it gives you guides of like how to pay and information about benefit packages and who to contact if they've got benefits and they think, or they might be taxed on it. So there are some good helplines out there. I think it's really important to have a choice whether people take payments or vouchers or anything. Some people want to donate it to charity. So if you don't tell them about that, you know, that's really important. A lot of people donate to charity and things instead. But also just simple things like feedback. Keep people informed as you're doing your work and your research. People love to be involved, you know, because some research projects I know I've been involved with, you put a huge amount of work into what would potentially might be a 2 or 5 year project, and you would invite PPI along. So I think more than just payments is feedback, keeping people informed of how your research is going, how it's changing, how you've changed it with their input. So as long as you're responding to them and keeping them up to date, you're keeping their interest. And equally, if something happens with PPI, it's not you as a researcher. Sometimes they have a family commitment that pulls them away. But I think little things like respect as well, the researcher. I remember once talking to a researcher and she said to me, I put so much effort into this and everybody's criticizing it and I'm so upset. And we said to her, we're trying to make your research better because you've got a brilliant idea. We just want to enrich it with our input. And we weren't actually being critical, but we had to be sensitive on our side, what we were saying, how it's received to a researcher. They spent hours on this like project and weeks and years, you know, so just, you know, a bit of respect from both sides, really. But,
Yeah, no, that's a really good point. I think that's a really good point. You know, I think if we're going to involve people, which we should be doing, and we're going to have a partnership, which is what we kind of started talking about, then it's got to be mutually beneficial, hasn't it? And the reason we're asking is to improve it and to make it better. So I think you're absolutely right. You know, I gave the example of my whole research design being questioned by a public and patient involvement panel, and that was really good. Actually, we then sort of re-looked at it and thought, well, how can we involve people a bit more? Can we include those comments? So yeah, I think you're right. I think researchers, we need to be more kind of open and let's face it, if it is criticism, that's okay, isn't it? We you know, that's part of a process of helping us improve within the partnership. And so it sounds to me, Heather, like we're agreeing on, you know, those conversations that really, you know, having open conversations is the most helpful way forward with this.
I think good research, especially for mental health, is about listening.
Yeah.
And, you know, if you're doing research from the very start, you can always establish some ground rules that you can have a two-sided discussion about. You know, it could be as simple as like switch your mobile phones off. If you're criticizing somebody, keep to the point. You know, trying to make it productive and not like so negative that somebody's upset in the room. Be sensitive. And this mental health is quite a challenging thing to talk about, and not everybody's is willing to talk about situations depending on the degree of mental health. But I think it's so important to get that awareness out there and get those conversations going, that we can make a difference for the future.
Yeah, absolutely. And one thing I'll mention as well, just for researchers, you know, those organisations that are around, like the Research Design Service, are really helpful, aren't they? Kind of, I guess that sometimes researchers might find it hard to connect with groups, you know, to find people that could advise them. And so, you know, there are organizations out there that can help make some of those connections. You know, there are organizations that are pre-existing that might like to help out with advising on research as well.
I think the one thing that researchers should know, Simon, is that there are support groups out there, but to make professional contacts as soon as they can, as early in their career as they can, talking to different groups, not just to recognise NHS and Health Watch, but looking at the community groups in the area that they want to work with, like Devon Carers or H Concern or Samaritans or the telephone helplines that they do. You know, look for different approaches than what you would normally think of. So sometimes the outside agencies like social services and the district nurses that see mental health out in the community, sometimes they can establish those gaps that people aren't researching. So those professional contacts, just those conversations, they can start up at the oddest places, and you think, God, must get their details, you know. That conversation, you might think, oh, that's so useful.
Yeah, you're absolutely right. Yeah, being proactive, I think, is really important, isn't it?
Yeah, cool. Well, I've probably exhausted all my questions I have.
Yeah, were there any more questions?
I think we did it all, actually.
Yeah, okay.
Yeah, cool. Thank you.